Hello everyone, welcome back to Raaonline. Today we shall see about polyps and tumors of the intestine. By definition, polyps are outpouchings of the mucosa that protrudes into the lumen of the gut. It can be either non-neoplastic or a neoplastic polyp. They can be either flat, sessile polyp or with a stalk which is known as pedunculated polyp. Among the non-neoplastic polyps of the intestine, we have three types. They are hypoplastic, inflammatory and hamartomatous polyps. First, we shall see about hypoplastic polyps. They are benign epithelial proliferations. They are common in elderly age group of 60 to 70 years and they occur because of decreased epithelial cell turnover. So, the epithelial cells are not shed and they are piled up. This leads to piling up of the goblet cells as well as the absorptive cells of the intestine. But absolutely, as we saw in the stomach polyps, they are having no malignant potential. So, they are common in the left colon. They can be multiple and of less size. It is just less than 5 mm in size. They occur as smooth nodular protrusions of the mucosa and lined by the mature goblet and absorptive cells. They can be serration, which is one of the characteristic diagnostic feature of hypoplastic polyp, but it should be differentiated from another entity known as sessile serrated adenoma. Here, in hypoplastic polyps, this serration is restricted to superficial layers, that is only to the upper one-third of the crypt. This is a microscopic view of hypoplastic polyp. There is proliferation of the cells. The goblet cells are well made out. The gap, these cells are the goblet cells. And they give a serrated appearance. And because of the delayed shedding of the epithelial cells, there is accumulation of goblet as well as the absorptive cells. And there is irregular tufting. So, because of this epithelial crowding, there is tufting and these are all the goblet cells. This is one goblet, this is one goblet, this is another. And because of this epithelial crowding and tufting, it produces a serrated architecture. But this serrated architecture is confined only to the superficial layers, that is upper one-third of the crypts. Next type of non-neoplastic polyp is inflammatory polyps. They are common in rectum. They are a part of a condition which is known as solitary rectal ulcer syndrome. They present with the classical triad of clinical symptoms of rectal bleeding, mucus discharge and inflammatory lesion of anterior rectal wall. They occur because of impaired relaxation of the anorectal sphincter and there is a sharp angulation of the anterior rectal shelf. So, there is recurrent abrasion and ulceration of the overlying rectal mucosa in that region. So, there is recurrent cycles of injury and healing. This leads to entrapment of the polyp in the fecal stream, which can manifest as mucosal prolapse also. By morphology, the inflammatory polyps exhibit dilated glands with superficial erosions because of injury, and as the name explains, there are increased number of mixed inflammatory infiltrate. Erosion is there in the mucosa and epithelial hyperplasia because of healing of the injured region. And the lamina propria can also exhibit fibromuscular hyperplasia because of recurrent episodes of injury and healing. This microscopic image shows numerous, this is one dilated gland, this is another dilated glands. There is epithelial proliferation of the glands, superficial erosions and inflammatory infiltrate. These are all the inflammatory infiltrate. This picture, close-up view, it shows the epithelial proliferation and inflammatory infiltrate. And here, these are all the RBCs and capillary proliferation is also there. So, because of repeated episodes of injury and healing, all these changes are there. The third type of non-neoplastic polyp is hamartomatous polyp. If they occur as a component of a genetic syndrome, they are pre-malignant. Otherwise, these hamartomatous polyps are also non-malignant. They occur because of developmental abnormalities, germline mutations of some tumor suppressor genes, They can be either in sporadic form or genetic form. If they are associated with syndrome, we also have extra-intestinal manifestations in other sites also, and they have an increased risk of turning into malignant carcinomas. These hamartomatous polyps are of two types, juvenile polyps and Peutz-Jeghers polyp. Juvenile polyp we shall see now. It is otherwise known as juvenile retention polyp. And as the name explains, it is more common in children of less than 5 years, and the common site is rectum. So, we have seen almost all the polyps of which we have seen, most of them are common in both the hyperplastic, the inflammatory as well as the juvenile. They are common in the rectum. So, it manifests, the child may complain of rectal bleeding. Microscopy, they are little larger than the hyperplastic and other types, about 3 centimeters. Mostly they are solitary.